Hi Betty, how are you today? My name is Mark. I'm your occupational therapist.
I'm good. How are you?
Good, good. So I was going over your chart and I did notice that this morning your oxygen level was a little low. So what I want to do is I want to just make sure that your oxygen is where we want it in order to do therapy today. So is that okay with you?
Yeah.
Okay, perfect. So I have this oximeter, and what I'm going to do is I'm just going to ask you to stick your index finger out.
Oh, I've seen one of these before.
Yep, this is not going to hurt. And this is going to tell you, or tell us, your heart rate and your oxygen level. So we'll take just a moment. Okay. All right, so your heart rate is 71, which is good. Your oxygen level, unfortunately, is 88. Now, what that means is that we're not going to engage in any extraneous activity because we want the oxygen level to go up. So what we're going to go over is two techniques. One is going to be energy conservation, because I know that before you came into St. Vincent's that you were independent in self-care, you were independent in meal prep, and you were independent in household chores. And I take it you want to get back to that independence.
Yes, yeah. I used to do everything by myself. I could move around. I could cook everything by myself, clean and get dressed. And now I have to rely on Albert to do everything.
Okay, and how old is Albert?
He's getting up there too. He's pretty old.
Okay, perfect, perfect. So what we're going to do is we're going to, one technique that we're going to work on right now is called pursed lip breathing. And what this does is that it removes the carbon dioxide from your lungs while allowing oxygen to come to your lungs.
Oh, okay.
Okay, so what I need you to do is just sit in your chair, relax your shoulders, and relax your neck. We're going to inhale through, don't do this yet. We're going to inhale through our nose for 2 seconds, and we're going to exhale through our lips for 4 seconds. And what I want you to do is when we're exhaling, I want you to pucker your lips like you're blowing out a candle and blow out nice and slowly. So we're going to try this once. Ready? So we're going to breathe in for 2 seconds through our nose. 1 Mississippi, 2 Mississippi, and then pucker your lips and blow out through your mouth for 4 seconds. 1 Mississippi, 2 Mississippi, 3 Mississippi, 4 Mississippi. What this will allow you to do is go back into a state of relaxation. So if you're doing any extraneous activities and you get to that point where you feel like you're short of breath, you want to remember this technique and make sure that you use this breathing technique to get through that activity.
Okay.
Okay?
Okay.
The other technique that we're going to learn is energy conservation. And what we're going to do is we're going to go to our kitchen facility in order to go through some techniques on how to conserve your energy in the kitchen. How does that sound?
That sounds like a good idea.
All right, wonderful. Well, let me just wheel you on over there, and we will be there shortly.
Okay.
All right, Betty, so we made it to the kitchen. How do you like our kitchen?
It's a little small for my taste. Mine's a lot bigger. It's a little messy, too. You guys should clean that.
Okay, and is everything set up the way that you have it at your home? Is the sink over here? And
the knives are over here, but other than that, it's the same.
Okay.
Just a little smaller area.
Okay. And how do you usually get around the kitchen? Do you usually do it mostly independently, or does Albert help out?
Well, before my injury, I was doing everything independently. I was cooking everything. I could, wash the dishes all by myself. But now, ever since my breathing started to get worse, and now because of the injury, I'm afraid that Albert's going to have to do a lot more for me.
Okay. So what we're here to do is we're here to conserve energy in the kitchen. We want to get you back to that as independently as possible and as quickly as possible. So there are certain techniques that we do use. One of them is considered meal prep, and what we do is we would sit instead of stand during meal prep so that you would conserve energy that way. Do you usually stand when you're prepping?
Yeah, I stand over at the counter when I prep my food.
Okay. Would you be okay with sitting while prepping?
Yeah.
You think that would be
I think I could do that.
suitable?
Yeah.
Okay. Okay, and then some other ideas are, do you usually use glassware when you're cooking and you're eating?
Yes.
Okay.
Yes.
So what we can do is, while you have the fracture in your arm, what we can do is we can use plastic and paper cups, plastic and paper plates, and plastic utensils, so that we can throw everything out once used, instead of having to do dishes and use the dishwasher. Does that sound okay with you?
Yeah, but if I have friends over, can I still use my nice china?
You can. You could, of course, always use your nice china, but I would recommend Albert or someone else helping you out with that. As long as you do have the fracture.
Okay. Okay, then that's fine.
Okay. We can also move the more essential utensils and accessories closer to you that you use more frequently. So is there anything here that you would say you use more frequent than others?
I use the cooking utensils, like the big spoons and ladles and stuff, a lot.
You use these a lot?
Yeah.
Okay, so what we would want to do is we would want to move these closer to where you could reach with your right arm and grab these more easily. So we wouldn't want to place them on the left because you do have the left fracture. So placing these on the right would make it more accessible for you. Of course, we wouldn't have this clutter as well. Is there anything else that you use more frequent than not?
Probably I use the knives a lot when I do my prep work. I have to dice the tomatoes and cut everything else, so I use knives a lot.
So do you think moving the knives maybe to the table or, closer to the sink would be better?
Yeah.
So that we can...
yeah, closer to the edge so I don't have to reach as far.
So, exactly. There. And then, of course, as I said, we wouldn't have all of this clutter here. Now, one more question when it comes to conserving energy. How do you go grocery shopping, or how do you get your food?
Oh, I go to Stop and Shop.
Okay, and do you do that on your own, or do you and Albert do that together?
Sometimes we have a little date over to Stop and Shop, but, sometimes I also have to go by myself if he's too busy sleeping on the couch or something.
Okay. Okay. Well, what we can do is, I know for a fact that Stop and Shop does have a delivery service.
They do.
So you and I can sign on the computer today before we leave, sign you up for that, so that all you have to do is go in, pick which groceries you want, hit submit. You can pay right on the computer as well.
I don't even have to go to Stop and Shop?
You don't have to go to Stop and Shop at all.
Oh.
And the groceries will be delivered directly to you.
They go straight to my house?
Straight to your house.
Wow.
How does that sound?
That sounds really awesome.
Okay. So in terms of what we learned today in therapy, the pursed lip breathing and the energy conservation in the kitchen, is there anything else that you would like to go over today?
No, I don't think so. I think I learned a lot today.
Okay, perfect. And right before before I leave, do you mind if I take your oxygen one more time just to document it for myself? Okay, perfect. Just 1 second. Okay, and just your index finger, please. Again, this will not hurt. Okay, and your heart rate remains to be good. Your oxygen is still at 88%. So if you do feel, any angst or anything like that, please use the pursed lip breathing. And if you feel any pressure whatsoever, hit the call bell and the nurse station will be over immediately.
Okay.
Okay?
Okay.
And I will see you next time.
I'll see you next time. Thank
Great.
you.
Thank you, Betty. Have a wonderful day.
You too. He's a nice young man.